Hi, everybody. My name is Suzana Marku, nurse practitioner and co-founder of Your Formula.
I'm Dr. Jonathan Zaidan, board-certified physician, co-founder of Your Formula. And today, we're going to be talking more about my topic. And my topic is, as a physician, making sure that if we're going to use Your Formula products, that we're using them in a safe manner.
Yes.
Right? I mean, that's what we really want to do, is we want to improve people's lives, but we want to do it with a certain degree of safety. There's no guarantees that anything that anybody uses is safe, right? Even aspirin might not even get approved today.
So I really like that we're having a separate discussion on this because one of the biggest patient concerns is, oh my gosh, is this safe? Oh my gosh, is this safe? And we have to talk about safety directly, right? Is that, you mentioned aspirin. Tylenol you can buy over the counter and it has a side effect profile like this high. And if Tylenol's abused, right, it can cause like liver failure, liver issues, right?
It can be one of the worst overdose drugs that you could take.
Yeah, absolutely. And that's bought over the counter. So I think it's really important that when our patients are listening to our podcast and patients are seeing all the different, or hearing all the different things that Your Formula offers, they understand that we are putting safety, so choosing the right product for the right patient and screening them if they're even a candidate for that formula.
Well, that's, I think, the biggest part of why you would use Your Formula. Our delivery system, the fact that we use a PCAB accredited pharmacy, the fact that we pay attention to quality, the fact that our dosing is consistent and monitored by external laboratories before we send it out to you. All of those things are reasons that you would use Your Formula. The fact that we're educating you about why to use it, that the combinations of things that we're giving you are safe and effective, that they're for the right problem, all of those things, again, are why you would use Your Formula. But one of the other big things that I think as a physician, I think is super important that other, places are not doing is, are they really looking for other disease processes? And are they monitoring what they're giving you? Meaning that, are they just giving you something that's coming in a wrapped box, with paper because it's discreet packaging because you don't want your neighbor to know that you're on something, right? And is that safe? Is it consistent? And the answer is, in many cases, no. I can't speak for all of that. All I can speak for is that what we're doing is making sure that you're safe. And we do that by, laboratory monitoring you. Mm-hmm. If you're not within a general location around Your Formula location, then you can get laboratory monitoring by some of the major labs in the country. It's interfaced into our system.
Quest Diagnostics?
Yeah. Why is that important? Well, it's super important that, some places don't have, a place to draw blood, but they may have a phlebotomy site, of a Quest Diagnostics or a LabCorp or something like that. And ultimately those studies can be sent to us. We also pay attention to cancer screening. We want to make sure you're healthy before you ever take this. Now, there's not millions of cancer screening tests, and we know that not everybody can go and get an executive physical and some of these really outlandish tests that people do.
But there are things that your provider, when you're doing your consult, not every patient's going to have access to every formula because they might be too high risk, and we identify that.
Right.
Patients, we're going to make sure that you have your mammogram up to date before we put you on estrogen. We're going to make sure that you've had a uterine ultrasound before we put you on estrogen, and we're going to make sure that you're for sure on some progesterone with that, right? These are...
People don't realize this is important.
People don't. But again, this is why I think Your Formula was so important, and this is why we started Your Formula, because we knew that there was a gap, and we knew that we could fill it well.
Well, I think your point is super well taken in that if we're not giving the best care, we shouldn't be doing this at all. We didn't do this because we needed more to do. We're both very busy people. As a matter of fact, even coming here today to do this podcast, I was busy for the first 5 hours of the day.
Yeah.
And then I literally was taking phone calls on the way to the studio today.
Yeah.
And the reason I was taking them was because of a patient that was actually in the hospital that I haven't seen in like 3 years, right? So we're constantly, doing something. So this is a big interruption even into our lives to give you this type of information. But it's so important, I think, that people know that we're not just giving you medicines. We're giving you the whole experience, right? I mean, we're giving you not only the products, but what a standard and reasonable physician should do for you, right? And maybe even a little bit more, because nobody's asking to do like anything supplementary, right? We're bound to what somebody somewhere in the system. I'm just going to say the system. I'm not going to call out where, because it changes depending on what location you're in. If you're in Canada versus the US, certain things are approved and other things are not approved, right? I mean, we're giving it to mass groupings of population in certain areas, and we're not in others.
Yeah.
We're not exactly sure why. Some people say there's life-saving things.
We're in Detroit, so Canada's what? Less than an hour drive.
And you could have an entirely different menu of options to treat a certain disease process just by going over a bridge or going through a tunnel.
Yes.
Right? And I mean, into a different country. So, there's just a lot going on. And I think what we do, I guess my role at Your Formula is to really make sure that the medicine seems right. Your role is to make sure that the patient, experience, the clinical experience is right? And our goal is to marry the two of those, right? So that people get a great experience, and then it's safe, it's quality, and it's delivered efficiently. And Your Formula is that. It's the right formula for you. And, when people ask me, what does your company, Your Formula, do? Because they see it, they saw it on my LinkedIn or something, right? And they're like, what does that company do? I say the same thing every time. I say, you know what? There's things in your body that you're deficient in, and they're different for everyone. And what Your Formula does is it creates the right formula of those supplements to help you with your deficiencies. And it's not a formula. It's the formula you need. It's your formula. That's the most important thing, Susie, is that we're not given, you know it, I know it, and everybody that works for us knows it. We're not giving things that are not the right thing. We're giving things that they're already been tried and tested. We're just giving them in unique combinations, and we're giving all the education, the testing, the safety.
You know what's funny? And I think you can comment on this as well, is Your Formula is just as much of a patient information source, right? As far as like educating. I mean, it's almost like a whole segment in just education, not just treatment, right? So, or not just, we're not just a pharmacy handing out meds. We're educating. I mean, we're taking, I remember you were on hole 12 and got off the golf course because we had to record a podcast to educate patients on bremelanotide, So, I mean, that is commitment to patient education, It's
a little bit of commitment to my partner too, right? Like if I can't leave you sit the entire time.
Can't let me sitting here like this for.
Plus, I don't want to say this because maybe there's one of these products that you can help me with, but when you shoot as many shots as I had shot for 12 holes, I was done. I needed a recovery phase. Maybe I needed NAD or something like that.
Yeah.
I don't know what it was, but it wasn't the worst thing being off the golf course on hole number 12 on that day. I'll tell you that.
So, but no, this is great. I love that Your Formula focuses just as much as patient education, patient safety with screening, proper selection. It's the whole package.
Thank you so much. I'm glad that we can educate you a little bit. You're hearing from us telling you what we do. I urge you to look into what we're talking about and look at, where you get these supplements. If you're watching this podcast, you're somebody who's busy, has a lifestyle that they need to make as efficient as possible. You're probably juggling multiple things like we are. This is what we built it for. We're building something that can be the right formula for you, customized, so that, you don't have to spend a lot of time going to 5 or 6 different places, different medical spas where people may not even know. They're more focused on microdermabrasion than they are about this, but they found this to be an adjunct to their practice, but they're not monitoring you appropriately. We're here to help you do the things that we want ourselves, have efficient healthcare and be the best you that you can be.
Thank you, Dr. Zaidan.
You're welcome. Thank you.